we go. Okay, so good morning, everyone. Today is Wednesday, October 21st, 2020. The time is, 9:06 a.m. We're meeting for our monthly elected officials meeting, which is considered a special meeting. I'm officially calling this meeting to order. Attending are Commissioners Duncan, Brooks, and Filios. And before I go into any potential changes to the agenda, let me just add that joining us on the conference phone is our clerk, Jim Brannon, and with us.
I think it's Chad's Jim.
No, it's Jim Brannon.
Hey,
Chad,
is Jim on the line?
Yes, ma'am.
Are there two Jims on the line?
There's one in this room.
Thank you.
Okay, fair enough. And also joining us is Chad Houck, who is with the Secretary of State's office, who flew up here on an emergency basis. We have a positive COVID test in elections. Things seem to be somewhat under control. And before I get on with the actual agenda, I did ask Chad to join us so that he could speak to us. He did get a copy, I believe, of the protocol. Nancy, you sent that? So Chad has that. So Chad, the floor is yours. We're here with our other elected officials. Go right ahead, sir.
Thank you, sir. Just a quick question. Is this a public meeting by chance?
Yes,
It is.
Okay. So as was noted, there was a positive test within the Kootenai County Elections Office as of about 9 o'clock last night, Pacific time. I got notified of that just for guidance at the Secretary of State's office. I flew in last night to assist, understanding that there would probably be some challenges this morning navigating this. As of last night, about midnight, the office had been cleaned by ServPro and was sterilized and ready to go for this morning. We've been in constant contact with the individual that tested positive as of last night, and have continued to stay in contact with that person throughout the day today. We have advised the individuals that were working. There were a handful of individuals that had previous positive testing themselves and that had recovered and returned to work. And as a result, they were the ones that opened the office this morning. It was disclosed to them that there was a positive result, so they were all aware of that when they came into the cleaned office this morning. As late last night, I reached out to the governor's office to try and get guidance from Director Jepson or his team with Health and Human Services out of Boise. They've been trying to put us in touch with Panhandle Health this morning, but they've all been on a webinar or a WebEx dealing with a handful of other things this morning as well, so we're still waiting for feedback from that. I've offered to address or deal with any press concerns as they may come up today in an effort to try and help that side of things. And with that, I'll pause for any questions and thank the commissioners for the opportunity to address them this morning.
Sure. And Madison Hardy, our local reporter, may be on the line again. She was on earlier.
From the Coeur d'Alene Press.
Okay.
Yeah. Are there
That's
any
fine.
questions for Chad? Chad, what is your go right ahead, sir.
Early voting is back up and operational. We did open at 8 o'clock this morning as was advertised, so there was no downtime or failure of service there. That means that the Kootenai County Elections is still maintaining the status with statutory alignments as they were yesterday. So. And I believe your question was going to be, what is my role? I'm the Chief Deputy Secretary of State.
Okay.
And of course, Chris, what Chad just said, by statute, we have to have early voting for 2 weeks. So we opened and we've gotten through our line. Everything is going as well as can be expected.
Okay, fair enough. Thank you, Chad.
The biggest impact, if any, was that there was about a 5-minute longer wait this morning for the first 5 to 10 minutes than there might have been otherwise. and that was as we took time to stage the temp staff that elections is utilizing. As I mentioned, we brought back first a group of individuals that were at one situational scenario. We brought them in first to make sure that we were ready to open, and opened with that group, and then moved on to some temporary individuals that had been asked to hold outside until we had a chance to address them. When we addressed them and gave them the situation, they all opted to return to work, and then did so, and that's how we were able to get back down on the line where we are.
Okay, fair enough. Any questions for Chad? None? Chad, appreciate your coming, especially on such short notice, and for addressing us this morning. If there's anything we can do.
And Chris, you don't appreciate it as much as I do. But yes, I also want to echo, I'm glad he was able to get here on such short notice. And we've got this handled right now.
Okay, great.
Thank you, Jim.
Good news. Okay, thanks.
Thank you.
I did get your.
About the only other impact, if I may, about the only other impact I'll note, because we're utilizing a smaller staff at the moment, phones are going unanswered at the elections office.
Okay.
We will look at possibly changing the voicemail recording to stop prompting people to leave a voicemail, and instead just letting them know, basically giving information on early voting and then dropping the call. But at the moment, we don't have staffing to be able to answer or address the phones. We'll look at that as the day continues on.
Understood. Okay. All right, then. Once again, any questions for Chad? Chad, thank you, sir. Appreciate your coming up on short notice. And if there's anything we can do to help, please don't hesitate to ask.
All right.
Thank you, sir.
Thank you again for the opportunity to address you this morning.
You bet. Okay, then. So moving on with our agenda, do we have any changes to the agenda? Sheriff Wolfinger. Okay. Add the internal report. That's okay. And that's fine, because it's a discussion item, right, I presume? It would have to be, right, because it,
Correct.
well,
It's not an
yeah,
emergency.
it,
Action item because it was sent out as an action item. There's certainly things that have to be discussed about.
okay.
Yeah, unfortunately, we're a little bit, it's not, it doesn't rise to the level of emergency, but it's administrative.
It's a federal law, so that would be an emergency and you'd have to take.
Yes, but we wouldn't, it's still internal. It's still internal. It's an internal process. So we can absolutely have the discussion, but making an action item on the agenda isn't
Yeah,
going to happen.
let's wait till we get there and we'll go from there. How's that? And the other thing that I'd like to add is the internal COVID task force that we have. The state has one, we have one. My particular concern is, are we adding a layer that we don't need? And are we slowing things down? And that's my concern as I look at two specific situations, but we can get to that later. So that's internal, call it internal, Kootenai County COVID task force. Okay, so let's start with our first item, which is the 2020 county holiday schedule, operating hours. Leslie.
Yeah, typically, day after Thanksgiving, we allow employees to leave at 3 o'clock using vacation. Same with Christmas Eve and New Year's Eve. So I just wanted to have a discussion with elected officials if you're okay with that, if you want any changes with that. I know last year there was some confusion last minute, but I think we all need to be on the same page and remember, when we get to the holiday, we can't just arbitrarily say we're closing our doors. It has to be ahead of time. It has to be thought out. And, Sheriff, to your point, it's very little of your employees are affected by this because they're essential.
Commissioners, I guess the big issue I have is you close the doors, you lock the building, but you require my people to use holiday or vacation time to supplement to make sure they get their full hours. That's not right. That's you're closing the doors, you're ordering the closure, and I give driver's license as a great example. What are they supposed to do after the doors are locked? but you make them take their time to make up the difference for your decision, and that's not right.
So-
What's our current policy?
That is the current policy.
Oh, yeah, I'm sorry.
No, no.
Sheriff, we need a microphone. It's not, you're not getting picked up.
Yeah, go ahead.
Not loud enough for the audience outside of here.
All right, yeah.
Go ahead.
The issue is that, you know, you order the doors locked, but my staff has to use their personal time to make up for the lost hours. That's not right. You know, if they had the choice to do it, that's one thing, but they don't have a choice. You're locking the doors, and
What time do we lock the doors?
3 o'clock.
Okay.
So they have to burn 2 hours of personal time, and if an employee is a new employee, doesn't have any personal time, they lose money because they don't have time to burn.
So I was under the impression we didn't actually lock the doors. They just, people had opportunity to leave early.
Oh,
But that's,
in the past, the commissioners have said the buildings will be closed at 3 o'clock.
okay. So Sylvia, what's your,
Yeah, go ahead, please.
The board can grant that time as paid and not charge to the employee's leave time, something like admin leave with pay. So in policy, it would allow for you to do that. It is, Ben is right, typically when there's a shutdown, the agency would cover that leave time rather than making individuals use their own personal time for that. So that would be just granting them a couple hours of additional holiday time off. And I would code it probably as admin leave with pay.
And what days are we talking about? Is it the Friday after Thanksgiving
yes.
and Christmas Eve?
And I think the Friday after Thanksgiving started because of the parade downtown. We were allowing employees to get out of the crowd. But I haven't heard if there's going to be a parade this year or not. So
Yeah,
it may be a moot point.
I don't know.
We may not need to worry about that. But Christmas Eve, I think typically we've left it up to individuals if they wanted to stay and work. I mean, Nancy Jones, is that how it's been in the past? Yeah. Yeah, so we haven't actually closed the doors on Christmas Eve. It's just been at 3, and then, okay. But then for years, we've just always required that people take their own vacation time to do that. Okay, and if somebody doesn't want to take it, do they just stay at work for those 2 hours? Okay.
And that's why the board discussed this every year individually to decide, board by board, case by case, how they want to get handled.
Okay.
It'd be nice to build into policy those closures and have them planned throughout the year and potentially look at it. I hear a lot that the day after Thanksgiving, a lot of agencies are closed. We'd have to see how our electeds feel about that. And either offer that as an additional holiday or we trade a holiday in exchange for it. So I did some research in terms of holidays, and we give 10 holidays based on policy, and then the board could give additional time by resolution and so forth. And so we have 10, City of Coeur d'Alene has 11, and so does Bonner County. Post Falls has 9. So it varies from having the day after Thanksgiving totally off to Christmas Eve off. But I think the real one is the day after Thanksgiving. We're seeing hardly anyone's around. That's something to consider, and we can take it up for
I
policy
guess-
or resolution
Sure.
at this point.
My concern with just closing the day after Thanksgiving is courts. Courts
Right.
have to be open, sheriff's department is still up and running. So I think that's a bigger discussion.
Yes.
That needs to happen.
And Barry, since he's gone, I did
Yeah.
have this discussion with them. He did say courts are open, some of his staff would have to be here. If that was the option that the board chose to go with, like closing day after Thanksgiving or whatever, he would like, as an elected official, the discretion to tell employees who have to work, you'll get another day off, but you have to take it by the end of the year.
Yeah, and that would
And,
be.
Okay, so-
and the discussion would be
So
brought
that's a
further
different,
into the
okay, so that's a
process.
different discussion. This gets a little tiring because it's every year we revisit it. We need a policy. As far as this year is concerned, I have no problem closing day after Thanksgiving at 3, Christmas Eve at 3, everybody gets paid, pure and simple. It's the right thing to do. Anyone else?
I agree.
Leslie?
It's fine.
Okay, we're done. Next. This is ridiculous. Every year, we need a
You
policy.
said we're done.
I'm sorry. Apologies. Ugh. You need a formal motion?
Can we bring it back on a
Business
HR
meeting?
Yeah.
business or HR meeting, and then that way
Yeah, that'll
it
work.
follows the
Let's
proper
do that.
path.
I agree, though.
That's cool. Okay.
Yeah.
Good.
Item,
Good job.
item number 2, topics for upcoming legislative luncheon. Leslie?
I didn't know if anybody wanted to discuss anything that might help other people decide. I mean, sheriff usually has a list.
Short list.
I only have two, and we had a meeting 2 weeks ago, the sheriff's board did, and this was part of our topic. First is the Clark decision, and the Clark decision is a decision, it's actually a Kootenai County case where the Idaho Supreme Court ruled that the law that allowed us to make probable cause arrest for misdemeanors not committed in our presence was invalid. And it has had a serious impact on how we respond to domestic violence situations, drunk driver accidents, things of that nature. There was an attempt last year, but the legislator who was carrying the bill messed with the language and it didn't pass. So we're going to be coming back with that. Right now, the impact has gotten so bad that now on those misdemeanor domestic violence cases that are so egregious but don't quite rise to a felony, we're calling an on-call prosecutor who's calling an on-call judge so we can get a telephonic warrant to make the arrest. So it does have an impact, on several different people, including the court clerks, because then they have to pick up all the stuff that carries on from the night before. And of course, these never happen during business hours.
Right.
They're always after hours. So that'll be a big issue that I would like to be able to discuss with the legislators at the luncheon.
Okay.
The other is driver's license fees. And COVID or not, we lose money at driver's license. And this last year, we lost $311,000 in change. It costs us, it costs us that much more than the revenue we bring in. The year before, we lost $227,000. Now, our revenue is down $51,000 this year, and that's pretty much COVID related. We know that. But our expenses are only up $20,000. So we're continuing to lose money, more and more money every year. We tried to get a bill last year. It got stopped by leadership in the House, but they said they're going to work with us this year with the Sheriff's Association, and we'd like to promote that to add $5 to the fee to come back to the counties to help offset those costs that we have here. So we'll be looking for that support from our local legislators. Of course, that's money that, any money coming in is good money, the way I look at it. So that's the only two I have for the legislative luncheon.
Great, thank you.
Okay. Anyone else? Sylvia?
So for Barry, he indicated he would let Chris or the board know if he came up with some topics for
Okay.
that luncheon.
Okay.
Great.
Anyone else? Okay. I probably have a couple of items that just haven't figured them out yet. One is, do they really need to go into session? Seeing what they tried to do with property taxes last year, I'd almost prefer to pay them to stay home. But that's my opinion. What's that? It's a little scary. It is, yeah. Okay. So that's it. Okay, update on county facilities. Leslie?
I don't know that we have a really good chain of what's happening with our facility, so I thought I would use this morning to just say, the sheriff's very aware of OEM moving from their location to the armory. I just don't know if anybody else has been made aware of it. University of Extension has moved out of elections, and so they are in a Post Falls location, which opens up potential for maybe county assistants to move out, which would open up more space in this building.
Right.
So I'm just letting everybody know kind of, some movement that's coming up, and it'll be another discussion with elected officials if any department is affected by that. And then we are close to, have we opened escrow? For the
Romer?
No.
Yeah, I believe we have.
Okay, so then we are in escrow with an office building, which we cannot disclose anything about it right now. It's per the terms of the agreement. An office building that will open up some space as well. And so we'll be in contact with the different elected officials if space opens up for that. It won't be available for probably 3 years, though. So we'll purchase the location, and then 3 years later, we'll have 100% control of it.
And once the agreement is finalized, which should happen, or the transaction, now probably within the next 5 weeks, maybe 6 on the outside, it'll be a joint announcement, so we're not at liberty to say anything courtesy of the seller. So that's the situation we're in right now, okay? Anyone else on facilities? Jody is in the process of moving out of the annex. The reason I bring that up is that Ann Taylor's running out of space. And so it looks like in the short order, she was looking at a potential other lease, and I said, don't even bother. The rates are outrageous. So she's going to have to stay put. I think we can move some of her defense attorneys into the annex in the short term. In the longer term, of course, with the construction project that's contemplated down here, hopefully that'll accommodate not just Ann, but Barry, AMP.
Yes,
And the two
and judges.
Right.
Judges. So the other thing is today at 1 o'clock, we are potentially selecting an architect for
Yes.
the new building to be located between the courthouse and the Justice Center. Right now, it's dubbed Attorney Center because that's who we're putting in there. So I guess that's all I have for facilities.
Bill, anyone else?
No.
Okay. Moving on. General pay plan matrix for fiscal year '22. So I'm the one tasked here. The reason I put this on the agenda is that, and I guess I have to focus on a particular organization, but I don't think the issue is necessarily limited to them. David Callahan is almost in crisis mode right now. And as we've said before, the number of permits are up dramatically year over year. It's something like 30%. And he is struggling to keep people. And the reason being that those permits are not just the unincorporated part of the county. They're in the cities, Post Falls, Coeur d'Alene, Rathdrum. And we've lost a couple of people. We have another resignation that occurred this past weekend. I just learned about yesterday. I'm not going to say any more on that because it's a situation that might not be totally unwelcome, but that's beside the point. Last week at the 11th hour, we saved another departure. One of our inspectors was offered $8,000 more to go to the Valley, and so we had to scramble. We're going to take that up tomorrow. And so he's in a tough situation. The builders are getting hot under the collar. And one of the things that I've heard, at least from that group repeatedly, actually also from KCSO, but your situation's a little bit different, is that they don't see any plan for growth. We don't have a matrix. They don't know how they're going to progress. So what happens when they get a competitive offer, it's not just the money they're getting up front, the increase in salary, it's that they can see how they progress for the next several years or whatever it is. We don't have that here. We have it for KCSO. We have an attorney paper. Is that it? The attorney's different. Okay, so it's just KCSO. And so I've asked Sylvia, I said, look, we have got to do something because we're going to lose people. We're going to slow down. We're in the service business. If we can't service our clients, our customers, which is really our residents, we've got a problem. Sylvia, did you want to comment?
Prior to the budget being adopted for fiscal year '21, the comp team put together a matrix, a 14-step matrix for the general pay plan, the chief deputies, and also the attorneys. We can update that schedule, which actually has already been done, and would like to bring something forward to the commissioners for consideration. And what we need to look at is HR needs to look at compression because we have a lot of tenured staff that are making about the same as those who are newer to the organization. So that's a compression issue. And we also need to look at compression from the standpoint, are supervisors making less than the employees they supervise? So HR is going to start that process and look at what that is. So we can bring something forward to the commissioners and the elected officials, if you'd like, with some strategy in addressing that plan and what it would look like. And then I need to deploy Nancy's finesse and spreadsheets and analysis to give us the numbers of what those scenarios would cost to implement.
Okay.
But we do have something we can bring forward in a 14-step plan for the general pay plan, attorneys and chief deputies. And in my discussion with Barry about the agenda, since he wasn't here, his comment was he would like to see some equity with the sworn officer matrix.
And what?
Equity, something equitable that people can see where they're going to go down the years.
Can you, just for people who don't know, define what compression is? Because if I were watching this,
Yes.
and then
Okay.
give me an example.
Absolutely. So there's a couple forms of compression. You have compression where a supervisor is making less than their subordinates. That's a form of compression. And the other form of compression is where you have, say, someone who's been here 14 years making about the same wage as someone who's been here 3 or 4. So there's two forms of compression, and there's a formula we can put into the system and analyze it and see what our hot spots are, and if there are significant hot spots that we need to address. I am hearing from a lot of the departments and the EOs that there's issues. We're seeing there's too much closeness from someone new to someone who's been here many years. So we'd like to see if we can get that addressed for fiscal year 22's budget.
Okay.
So we would just need that guidance from the board if you want us to proceed with it.
Thoughts?
Yeah, I'm fine with that. We just have to keep in mind, like, cost. I mean, if we
Yeah,
can't
oh, yeah.
afford it, then it being in place is going to be more harmful than good. So we just have to make sure that that's at the forefront. I want to make sure that all the elected officials are on board, because there are a lot of pitfalls with this program. I mean, they have to be making sure that they are examining their employees and not moving them through the steps if they're on performance plan, if they're not,
Yes.
performing. That has to be documented. So it's not a solve all problem. It's going to create a lot of problems that I want to make sure are addressed before we adopt anything.
Absolutely, and we would need to build that into the policy that if an employee has a performance improvement plan that's officially documented, that they would not be eligible for a step increase or progression. I think that's one way to address performance issues. We would also need to build in that, our progression through the steps is based on budget appropriations.
Yep.
Okay, good points. Thank you. All right then, so enough on that. Anyone else? No? Okay. COVID-19 point of vaccination site. We were approached by you want to come up, Sylvia? Okay, basically what this is, we were approached by Panhandle Health I shouldn't say in the event, but because it's quite likely, but when the vaccination becomes available for COVID, could we be a vaccination site? I'll turn it over to Sylvia.
Yes, Panhandle, as Chris mentioned, did get a hold of HR in reference to what they're doing is reaching out to large employers, and we're considered a large employer with 850 employees or so, and they're willing to set up sites here for our employees to go through the vaccination process for COVID-19. Of course, it's all voluntary. And the way the process initially, just some preliminary planning that they're doing, is they would be distributing vaccinations by tiers. So your first tier would be your critical workforce, such as healthcare workers, then probably your other essential workers, such as first responders. Your next level would be those at risk. So those vulnerable populations, and then the general population, those of us who are healthy, would then be that next tier. So It's really nice because it's convenient to do that. Most likely it would happen spring, general estimate. It is potentially right now a 2-dose series. So what would happen is Panhandle would come in, we'd get our first round of vaccine, 21 days later, we'd have to come back for a second round. If we're interested, they'll send me some additional paperwork. I think when we decide if we're going to do this, we'll have to involve the Emergency Operations Center and their Panhandle's emergency preparedness site to get this all set up. My experience in public health has been when you do mass vaccination clinics, you have to set up the intake, the triage, you get your vaccination, and then you sit around for a while to make sure you don't have a reaction to it. So we'll need a lot of people involved in this, but I think it's a good option to offer to our employees. It's convenient. I'm sure they will be having mass vaccination clinics for the general public, but this is an option that I think is very good for our employees to be able to access it here.
So would it be different than us offering the flu shot? I mean, does the same thing happen when we offer the flu shot?
It would be similar to that, but higher volume probably.
Okay.
But they would be managing it versus, we'd have, instead of having Costco come in, Panhandle Health would have a series of staff who come in and staff that, and probably the Emergency Operations Center team to set that up. I'm not sure how H1N1 was handled here for mass vaccination clinics, but my experience in Pueblo was that we had all hands on deck. We worked different stations. It's a little different, a little more intense than our flu shot clinics.
All right. I saw what it was when we had the flu vaccination site. It is a little disruptive, so I just want to make sure that it's scheduled for a date and time that would minimize disruption here. I don't know. I'd like to hear from the elected officials. Are you in favor of that? Are you not in favor of?
Sylvia, no, go right ahead. I can, well, go ahead, Ben.
For us, absolutely, we're in favor of that. But just so you know, when the county did their flu shot clinic, we also did one at our office. We use the Marine Building. We have a pharmacist through Safeway comes in, and it goes. We've done it for years that way. And since we have over 300 employees of the county employees at the sheriff's office, and we'll be in that first tier for most of those employees, we'd just do it there and set it up like we've done in years past. Very little disruption, actually no disruption here on this campus. So we would prefer to do it that way. And I've also been talking with the health district. I meet with them every week, and when that vaccine comes available, we would just set that up and probably invite the other first responders, whether it be fire or the other law enforcement agencies, since we do have the facilities there to manage that. So,
Who's, excuse me, I don't know if this is premature, Sylvia, but whose vaccine? Or are we going to have multiple suppliers? Do you know?
I don't know.
Because right now, the leading suppliers appear to be, well, I can't say suppliers, but at least because they're in test phases, are Abbott Labs and Moderna. Do you think it'll be multiple suppliers? We don't know yet.
I don't know yet. I don't know if they know. I think that's a question for Panhandle Health versus me.
Sure.
Yeah.
Okay, fair enough.
Joe, do you have any comment about disruption and stuff here? Or how would your team handle it?
And they may tell us, they may have to do it at the fairgrounds if that's the location they pick, and then we'd all go there. But it'd be a session for our employees and hopefully potentially our immediate family members.
Yeah, from the assessor's office standpoint, I don't see where even a location here to cover the administrative staff or the operations that occur on this campus would be covered. It makes sense instead of requiring however many hundred of people we have here going to another location. So much like our health fair or other annual type of activities where we're trying to consolidate service into a single location.
Okay.
Makes perfect sense to me.
Okay.
Sure. Thanks.
Good.
Steve? Okay. And then doctor, I mean, it wouldn't, your people would just probably go to KCSO since you're close by. Yeah, so, Jim, are you still on the line? Keith, do you have a comment representing your?
Yeah, clearly the closer it is here,
Better off, okay.
And they really do. The public health system has experience in doing mass vaccination clinics, and it is very efficient. It's pretty neat to see how everyone comes together and how they deploy medical professionals and lay individuals to make those things run smooth.
Okay. Anyone else? Yeah, go ahead.
Yes, it's somewhat related to the actual facilities being provided. I think it's a bigger question, though, is down the line, do you anticipate the county taking a position that no, that if you have not received a vaccination, you cannot enter the building? And is that going to be something that we're going to look into and study and come to a conclusion?
I think that's their question.
Yeah,
Then I'll have to work from home. And it's not that I don't want to take the vaccine, but I won't take it until I'm convinced it's safe.
yeah, I would never mandate any vaccine for any county employee.
I agree with that
But,
completely.
and I'm not asking for
No,
a question, I mean, an
understand.
answer from all you, but I think it's going to be a question that's going to be put upon us
Probably.
soon. And we might want to start looking at how we want to formulate an answer. At least that's where I see this going, so.
Well, it's hard for me because it's a 99.5% survival rate. So to demand that kind of thing, I mean, it just, I'm not there.
I think it's unrealistic to think people streaming in the front door and the back door are going to somehow prove that they've been vaccinated. I don't want to go there.
But the question is valid because hypothetically speaking, let's say X number of the population, be it here, be it across the country, take the vaccine. And then downstream, we have data that indicate that the people that haven't taken it have their own pandemic. Now we have it, and that raises the question that you're posing. But I don't think we would know that for a while.
I just see this as a big question coming at us
It could.
quickly. So, thank you.
And I did want to let you know, in speaking to Barry about this, he liked the idea of a convenience of having clinics for our staff.
Okay. Thank you.
So is it yes or I can?
I think we're saying yes,
Okay.
yeah.
All right, thank you, okay.
Yes.
Just want to make sure.
Okay. Ben, your item, sir? Yes, sir. COVID internal reporting memo that we distributed yesterday. Go right ahead.
Yeah, the email said this was a reminder, but this is the first time I've seen this. And I can't be reminded of something I haven't seen before. So that was my first thing, but there's 8 bullets here, and I'd like to go through those. The first one, obviously, is very appropriate. Positive test results should be reported to their supervisor. Totally appropriate, no
Okay,
question.
Go ahead.
After that, then the supervisor informs their elected official, and then the team. Now, I'm assuming that means the county management team. That's not appropriate.
No, that's not the team.
Well, then it
But
needs
it's
to be
not
obviously
identified,
clarified.
huh?
Yeah, there's no team identified here. So the only team that we have was the team that was emailed to, and that was the county management team.
Yeah, no. I don't
team
have
is
a
it?
copy of that in front of me, so I would need to, if you want to just hand it to me real quick, I'll look at it. And
What's in, no, go ahead.
It says supervisor informs elected official, then team, as appropriate.
Okay, so that would be your internal team.
Yeah,
So if it's the records department, you would notify anybody in there that you felt appropriate.
Okay, but I'm not sure that the board has the authority to dictate who I tell in my office.
Okay,
Okay?
so that would be, HR would have to talk about that, because I don't know what the implications are if you have a positive in a,
Well,
All
and
right.
we manage those positives, and we have positives today in my office, and we manage those appropriately. But those, And then we can't be sharing the name of that
Correct,
individual.
absolutely, right.
Because that's a HIPAA violation.
Yep.
So that's a concern. It says then that the department elected official or department head informs the board. Well, no.
The reason-
There's no reason, there's no lawful reason for that. And in order to give you the information you want in this, according to this memo, it has to, you have to have the employee's name. And that would be a HIPAA
No,
violation.
I've never heard an employee name. When they have reported to me, not one name has ever been given to me.
Even this morning, I have no idea. We have no idea who the individual is.
Okay. The next one says that the BOC staff notifies IT, Buildings and Grounds, Reprographics, and Human Resources. Not the job of the board. That's my job as an elected official or my designee. And we do. We reach out to Human Resources pretty darn regular. I mean, that's, they're a great resource.
What item is that, Ben?
It's item number 4 on this list.
Okay, go ahead.
And then it says the department head or EO communicates with human resources. Absolutely. And it totally eliminates, that by itself eliminates the 2 previous bullets. And then it says the department head for affected department must coordinate mail delivery adjustments with reprographics. Well, if it's necessary, but must is a mandate. And when you're writing a policy, that's a mandate. It may not apply to my office, may not apply to anybody's office. If I have a graveyard dispatcher that turns up positive, reprographics doesn't have any interaction with those graveyard dispatchers, so why would they care? You know, so I mean, it can't be a must. In number 7, it says the communications manager will communicate any closure, service interruptions, and adjustments to employees.
Read that again, I'm
It
sorry.
says communications manager will, another mandate, communicate any closures or service interruptions and adjustments to employees. And then in parentheses, it says, and the public, if requested by the EO. Well, why would they be responsible for reporting it to the employees? If we're going to have a service interruption, then we need to, that falls back on the responsibility of the elected official. And then the last one, it says department head or elected official for affected department will, another mandate, communicate updates to the BOCC liaison if service levels are affected. You can't compel that. I mean, absolutely, it's a courtesy, and just like Dan did earlier this week, yesterday, he did that. We may have a service disruption in my office. Mm-hmm. But that's a courtesy. It can't be a mandate. And there's no legal standing for that. So those are my concerns with this. It's unclear. And it goes beyond the scope of the authority of the board.
Okay, I have some questions for you.
Sure.
This is hard because first of all, has this undergone a legal review?
Well, I sent it to legal yesterday, and they agreed.
Oh, okay.
with
They
all my
agreed with all
points.
these points?
Yeah.
I'd like to have a discussion with them because I'll take you up on your first point, informing the team. If you don't inform the team and they don't know what's going on and somebody else contracts it, don't we have a problem? Don't we have liability?
But that's an internal thing, but that's an internal for me to deal with, not for you to deal with. That's for me to deal with
Okay,
as an elected
here's where
official.
you and I are going to differ. If we go to a court of law, Ben, they're not going to look and say Ben is a separate elected official from Duncan or Filios. They're going to look at us as a single entity, and that's my concern. I have no desire to dictate, but I also don't want to put us in a position of unnecessary liability. That's my concern. Some of your
I
other
understand
points
that.
I think I can understand, but if the communication isn't clear and it isn't open and it puts other employees at risk, I think we've got a problem.
But that's I agree with you, the liability, but I think that's my responsibility.
And I don't think we're trying to take away any responsibility from any elected
Yeah, we're
official. I
not.
think the initial reason was just to have a policy in place to say,
Yeah.
these are the steps you follow if this happens, because that has been the feedback that we've received as a board, is we want to know what to do. What our employees are asking, what are our department heads supposed to do, so we know, we feel comfortable. So
Well-
that's how this thing came about. I'm happy to look at it, and I've made notes on your points, and happy to rework it so it's a little more palatable. But we
does-
still have to have something in place.
Does Darren have it? You sent it to Darren? Yeah, okay.
I ran it by Darren.
And this item was discussed in, I think Leslie led the discussion about communication and going out and our due diligence. of notifying employees and those specifically more of those service areas that have direct contact with all the staff here. And since it's a communicable disease, I believe CDC recommends it, Panhandle Health recommends, communicate to the extent you can, because we don't know who we've all been in contact with. So just that open notification, and you see restaurants doing that. Hey, we had a positive. If you've been in our facility, you may want to have a conversation with your provider, and so those sort of things. And the group had agreed, let's communicate it. It's a communicable disease. And I think Steve was in that meeting, and so was Dr. Keene. So we had that discussion, and it's more about our due diligence to notify people. So maybe some of the language is a little stronger than you prefer, but I think we do have due diligence to notify.
Yeah, and I can talk to Darren and we can rework it. to
Darren's
make
got
sure.
it. Let's see what he comes up with. Yeah.
I guess my concern is this got sent out yesterday without legal review, apparently. And, you know, we're here wasting our time because this wasn't done properly. And we've got, you know, there's obviously several issues in here that need to be addressed. And it shouldn't have gone out that way. It needed to have legal review first.
And
Yeah,
I
your
see
point
it
is
more
well
as
taken.
like the guidelines that we issued, more as guidelines and a framework, so
Policy.
that we have open communication about it, working through these unprecedented times. But I don't know.
And I guess when I write
Policy
policy,
at
if
this
I
point.
can never think of an exception, I never put a mandate.
Okay, fair enough.
So, you have other issues there, Mr. Phillips?
No, I'm fine. With Darren having possession of it now, I'm looking forward to his review. Let's see what happens.
All right, very good.
Okay, thank you.
Thank you.
Okay, so we're done with that? Okay. The final item is an item that I added for discussion, which is the internal COVID, am I saying this right, COVID task force? And this is the group that, I don't know how many people are on it. Is it 5 people? I know Jody, Dina, is Kim on it? And a couple of other people. We've had a couple of situations of late, and this is my concern. The COVID task force conducts an initial review before it goes to the task force. What's the name of the task force with the state? The
CFAC.
CFAC, okay. And so what's happening is, and I guess I'm going to ask the question, is are we running into unnecessary delays? And I'm going to use 2 situations. The one that was actually quite recent was the situation with the fairgrounds. Is it reimbursable? Is it not? What is it? Back and forth, back and forth. The money that is available, which is, what is it, the $4 or $4.5 million that the state is giving us for, you know, COVID-related expenses has to be spent by the end of December. So having this internal group is another layer potentially, okay? Second case, which has to do with the audio-video system for this facility. We took this up when Josh came forward, I don't know the name of his company, but about a month ago, and we said, or the proposal was made, well, let's go out with an RFQ. Well, you don't have to go out with an RFQ. Best practice? Sure, but not when you're under the gun. And so here we are, it's a month later, we don't even know if we could implement the damn thing in time. Look what happened this morning. Chad is trying to speak, Tina's can't quite make it out. It was broken up as he was speaking. We have to move forward. So what I'm saying is, either they're going to enhance the process or let's do away with it and go directly to the state. I also heard a comment yesterday where the state is saying, isn't that interesting? Why do you guys have a task force? It seems we're the only county in the state that has done this. Maybe that's a smart thing. I don't know. But once again, the clock is ticking and the money has to be spent, the implementation, by the end of December. Has anyone had any issue with this? Or is it just that we're seeing it at the BOCC level? Okay. Anyone else? I don't know who's on the task force. Then you haven't had a problem. Bill, Leslie?
I don't have a problem with the task force. I think where the communication breakdown is, they bring us a recommendation, we decide. And I think that needs to just be more clear. They bring us a recommendation, we decide. So that's, I think that things get muddled. Okay, well, task force says this, so now what do you want to do? And then things get lost and shuffled and put by the wayside. So I think that we can avoid unnecessary delays by COVID task force having a very quick turnaround at this point, and then making a recommendation, and then we act on it. So I think that will clear up some of the things. But what I don't want to do is jeopardize any airport grants by us not following the rules and then coming back and now they're, saying, I mean, that would be very damaging to us.
Yeah, I don't know that we'd have any choice but to follow the rules, only because if they went, we appeal directly to the state. The state would say, no, this is unacceptable.
But who's going to do that? I mean, are you going to take every COVID thing and you're going to go to the state with it? So that's what the task force is.
Nobody else is having a problem, so I get the impression that either you've gone directly to the state or you really have had no need.
Right. I don't think they've had any.
Maybe you haven't had the need to go for the dollars. Okay, so my concern, I'm fine with what you're saying. What I don't want the task force to do, and it's happening in one case, is getting involved in the implementation. That's not their business. Their business is simply to assess whether or not it's going to cut muster for reimbursement.
Yep.
Okay, and I have
I
a
agree.
specific concern when it comes to the audio-video system, so I'll leave it at that without getting into personalities.
Right. Well, that's the whole thing with the audio-video situation. It should have been, okay, we recommend you go out for RFQ. We decide we're going to go out for RFQ or we're going to not. So that's,
And we never made that decision, did we?
no.
Okay, maybe that's our fault. Fair enough, okay. Anyone else? Public comment? None. Let's call it 10 a.m., meeting adjourned, thank you.